పక్క వెయిట్ చేస్తాను. లైట్ ఏమైనా ఆన్ చూడండి.
Hi, good morning, everyone. Welcome to this webcast on sleeping well, tips from a cardiologist. We all, at some part of in our life, face the issue of unable to sleep, and this discomfort we are going to address now. So I will try to keep this topic as simple as possible, and I'm sure at the end of this topic you will be able to see many additions on how you will be able to sleep well. Just give me a moment. Okay. Sleeping well is a key to healthy life and can benefit your heart, weight, mind, and many more. So today, for the next 30 minutes, I will be discussing about what is a normal sleep, what are the disturbances a person can experience when his sleep is disordered, and finally, I will try to provide you certain very important tips for you to how to sleep well. Every one of us has got individual preferences to sleep. The posture might be different, the place where we sleep might be different, the way how we sleep will be different, the depth of the sleep will be different, the ability to snore or not to snore will be different. So each of us has got different ways of sleeping and different individual characteristics of sleeping. But what happens today, what we are going to discuss would be what happens if a person would be sleep deprived. What happens if a person's sleep gets deprived? So how he is going to manage that? Why a person will get sleep deprived? So these are the key components of the presentation today. Sleep used to be the least studied science of all. Of all the people, whenever we people used to study how a person works, how a person walks, how a person thinks, but sleep was the least studied till the late 19th century. And it used to be left for the poets and dream interpreters. What is a dream or what is about a sleep? So, the sleep used to be a thing which we used to think is not a scientific thing. And sleep was usually thought to be a process the brain would get turned off. As we go in this presentation, you will realize it is not just a turning of the brain, but what are the various advantages of sleep and why sleep is mandatory and why when a person is sleep deprived, how he can feel groggy. Sleep is normal response to the silence and darkness of night. That used to be the observation of certain other people in the 16th and 17th centuries. People used to think because when the night falls, the area is completely dark and it is silent, so the brain also gets turned off. But in the 20th century, in the early 1930s, with the invention of electroencephalography, EEG. Electroencephalography or EEG means is a test which will record the waveforms of the brain. So it indicates whether a person is active or whether the person is sleeping, whether the person is angry, whether the person is agitated, or whether the person is having a fit. So all these things can be identified by a EEG. Just like a heart, you do an electrocardiography or an ECG for the heart beating. So also EEG is a test to look at the brain beating or the brain neuro waves. So, with the advent or with the invention of the EEG in the 1930s, our understanding of science of sleep has radically changed. Right now, we all know that sleep is essential for health and optimal functioning. If you look at a normal sleep cycle, you got two different types of sleep. One type of sleep is the non rapid eye movement sleep. If you see this, the PET CT scan of the brain, PET CT scan of the brain is an advanced form of CT scan of the brain, where you can see these are the red spots indicate that the brain is active. Both the pictures have been taken from the same person during the same cycle of sleep. Whereas if you see on this panel, you see that the red spots are less, whereas if you see on the right panel, the red spots are more. So, what you need to understand is even in the same sleep cycle, there are distinct phases of sleep. The left panel is what we call as the non rapid eye movement sleep. Non rapid eye movement sleep. That means when you sleep, even though your eyelids are closed, the eyelids keep flickering. So, that is what we call as the rapid eye movements. So, when the person is having rapid eye movements, it has been seen that the brain is much more active. But whereas when the eye movements are not there, that is non-rapid eye movement type of sleep or a non-REM sleep, we say that the brain is little sleep, it is inactive. Whereas in the REM sleep or the rapid eye movement sleep, the brain is active. So we have now understood that there are two distinct phases of sleep. One is the non-REM sleep and other is the REM sleep. So then we will understand what is this non-REM sleep with the REM sleep. So every person, when a person, let us say a normal sleep cycle is between 7 to 8 hours of time. During the sleep cycle, you have got five different stages of sleep cycle. So the stage one or the N1 is when there is a light sleep. For example, if a person just put rests on the bed, what happens? Slowly, some light sleep will come. Sometimes while working, also somebody will fall into some light sleep. So this is the stage one or the N1 phase, where the muscle activity slows down. But still, if you recollect, when you are sleeping in the early phase of sleep, suddenly you have a jerk, so that you will have that this occasional muscle twitchings also can happen. So this is the normal for a N1 or the stage one sleep. Then the second thing is stage is the breathing pattern gets slowed, the heart rate gets slowed, the body temperature also slows down. So this is the stage 2 of the sleep, where the patient the person gradually goes into the sleep. So what happens is the breathing gets slowed, the heart rate gets slowed, the temperature also gets slowed. The third stage is this stage 2 is what is called as the non rapid eye movement stage. So here in this picture, you can see that there are various electrodes which are connected, which record the ECG or a graph of the brain, EEG. That is what we call. So this is what is the brain electrical activity. So this phase is what is called as the non-rapid eye movement phase. Then here then later on, the person goes into much more deeper planes of the cycle. This is also a non-rapid eye movement where deep sleep begins and brain gets to generate the slow delta waves. This is the classical form of these are the delta waves. Here also you can see some disturbance, but here the brain is entirely sedated. This is the deep phase of the non-rapid eye movement. This is the stage 3, This N1 and N2, you see that there are some degree of brain activity, whereas once you come to the N3, the brain is almost silent. Then when you go to the stage 4, this patient is once again in very deep sleep. The delta activity becomes more and more prominent. Here the delta waves are slow, but here the delta waves are more prominent. So the brain activity is different. Then what happens suddenly? The person starts moving. That means there is a rapid eye movement. That is the stage 5. And here, this is the phase during which the person starts to dream. The muscles relax, the heart rate increases, breathing is rapid and shallow. So this is the rapid eye movement stage or the REM stage. So you can see between stage 3 and 4, the sleep is very deep, whereas in stage 5, the person starts flickering his eyelids. So if you can say that this non-REM sleep is the sleep which restores the body. Each cycle of sleep cycle should have both REM and non-REM. So in the non-REM phase, the body gets restored. That means the muscles get relaxed and all that. So what happens is, their idling brain in a movable body is a non-REM sleep, whereas the REM sleep is the phase where, as you can see in this, the brain is much more active, where the brain is active in a paralyzed body. Here the body moves in the non-REM sleep, but the brain is inactive, whereas in the stage 5 or the REM sleep, the mind is active but the body is paralyzed. So what happens is, here the brain is active, here the body is active. Here the brain is inactive, here the body is inactive. So this is how you can say that a REM sleep versus a non-REM sleep. If you see in a complete sleep cycle, as you go from stage N1, N2, N3, and all that, you see that as you go deeper and deeper, you see the REM is increasing and the non-REM is decreasing. You see the non-REM is high, but non-REM is decreasing and the REM is increasing. So what happens is, if a person sleeps for an average cycle of about 7 to 8 hours sleep, in the latter part of the sleep, the rapid eye movement cycle is increased, whereas in the early part, the non-rapid eye movement is increased. So that means then the early, that is the reason why if a person, let us say, sleeps at 10 or 11 and wakes up at around 6 a.m., at around 5 a.m. to 6 a.m., he will have the maximum number of dreams. That is why we think that the early morning dreams are there, because dreaming happens only in the REM cycle, whereas in the non-REM, there is no dreaming. So why should a person get sleep? Why should a person feel sleepy? So this is where we need to understand. This is called by the term called Zeitgebers. Zeitgebers. This is a German term which will say time givers. So that means what happens is, for example, you see in this clock, between 11 to 6, a person is sleeping. This is the sleep schedule for that person. So at 11, if you go to the bed and fall asleep, so this is the time what you have established a sleep schedule. So this is that sleep schedule varies from person to person depending upon the age. So based upon that, you say whether the person can sleep at 11 o'clock or 10 o'clock. Somebody has a habit of sleeping at 9 p.m. So whatever it is, a person should ideally sleep between 7 to 8 hours. That is the sleep cycle which is required for restoration of brain and physical activity. The other thing is the daylight. As long as the daylight is there, the person is active. Once the night falls, darkness comes, the person will become inactive and sleep comes. And hormonally also, melatonin is one important hormone which promotes sleep, and melatonin is released at nights. So you need to understand that sleep has got a particular cycle. It has got two components. REM component is rapid eye component, which happens more in the latter part of the sleep, and early part is got the non-REM sleep, which is a deep sleep. REM component sleep is the sleep when we dream. And for a person to fall asleep at a particular time depends upon the light, depends upon the hormonal status, and also depends upon the time at which he has conditioned the body to sleep. Then other question which comes to us is, why do we dream? If you are any language literature from the childhood, if you see, there are a lot of dreams, common dreams which can appear in his sleep. for normal people, and the interpretation of the dreams is a thing which our elders used to tell us. Sigmund Freud, an eminent psychologist, has written a book in 1899, The Interpretation of Dreams. So, in that, he has given a lot of different scenarios of dreams and how to interpret them. There are a lot of dreams which you can happen, many of us experience. For example, myself, I used to get a dream in my childhood that I am falling away from a big, tall building. So we used to interpret as a past life's experience and all those things. It is not right. So it is not uncommon for people to experience dreams of some calamity happening, like, for example, a tiger chasing them, or inability to appear for the examination, roaming naked on the roads. So such sort of dreams are common for people, and it has got a lot of interpretations. Sigmund Freud used to has interpreted them as dreams represent or reveal hidden conflicts, desires, and fears, although in a disguised form. There are other scientists who had done who had interpreted sleep as a phenomenon to organize their thoughts as well as consolidate and reinforce long-term memories. So they used to think that the sleep is a time where the memories get consolidated. But what happened is EEG is one of the first investigations to make a sense of the dream, and it has interpreted dream as a cohesive story made out of randomly generated memories. That means, for example, you encounter something in life that gets stored in your memory, and you might encounter something else subsequently. So they usually come from a deep seated memory. So these are all some memories which are there, and the brain tries to interlink these memories into a cohesive story. That is what it represents, the dream. That is what is as per the EEG, or the brain electrical recording evidence of the sleep. So how do dreams help us? Yes, the dreams help us by threat simulation. For example, scientists have found that if a person gets a dream of a very difficult scenario, for example, he is to face the examination, and the same dream of appearing in the examination or for the interview gets cycled in his mind, he is more prepared for the examination. Dreams help us in memory and learning. It has got multiple advantages, but the least what you can see is it helps you to memorize things and learn things better. So as you have known, two out of the two sleep cycles, the REM sleep has got emotional events memory. That is the reason why people get woken up in the sleep with a bad dream, because these dreams are emotional events and they happen during the REM sleep. Whereas the non-REM sleep is a spatial memory. That means if a person is in deep sleep, what happens is you have read some chapter or certain points in a textbook. So you might not be able to recognize where the chapter is there or where you have kept certain items. Those things will get more clear during your non-REM sleep. So that is what you call as the spatial memory. So REM sleep and non-REM sleep have got two different effects on the memory. You will you must have definitely seen dogs also having sleep during the sleep dreams. So during sleep, even a dog tends to have dreams. So indicating that dreams are a part of the evolution, and it has got a fundamental biological role. The fundamental biological role is it organizes your memory, both emotional as well as spatial. So this is what is about the dreams. What happened to the sleep as the person ages? So usually as the person ages, the time required to sleep is gradually increasing, and at the same time the total sleep time is gradually reducing. If you look at it, the stage 2 and stage 3 sleep. This is the stage 3 or the non-REM sleep, which is there about 20% at the age 20 is just 7.5% in at the age of 8 years. So the depth of the sleep and the quality of the sleep decreases as the person ages. And the time asleep in the bed, while in the bed, that means a person lies on the bed and he sleeps off immediately at the age of 20 years or at the age of 40 years. But after the age of 60 years, 70 years, the time required to fall asleep is increasing, and the time the person is asleep while in the bed is also reducing. So, indicating that elderly people tend to have more difficulty in falling asleep and also have a tendency to arise early compared to a younger age. Now, we will look at the sleep cycle during various phases of life. The first phase is during the childhood. Newborn children, we must have observed, sleep 8 times a day and they sleep for about 18 hours, and half of them is in the REM sleep. That is why when you see the small children, when they sleep in the bed, they keep dreaming, smiling all through. So that is why, because they tend to have more of REM sleep compared to non REM sleep. But by the age of 6 months, they tend to get longer and more regular periods of non REM sleep. That means they tend to get more deep sleep by the age of 6 months. And by the age of 6, most children are awake all the day and they sleep for about 10 hours at night. If a child sleeps during the day at the age of 6, then you must suspect that there is a problem. Usually, children sleep all through the day and sleep for about 10 hours at night. Between the ages of 7 till puberty, nocturnal melatonin is at its peak, and here at this age, sleep is at deep and restorative. So, that is the age when they get very good sleep between the age of 7 till puberty. During adolescence, teenagers need more sleep than they did as young children. That means if a child sleeps for about 7 hours, a teenager requires 8 hours. But most of them actually sleep an hour or less because they they start watching television, they start playing video games. So they actually sleep less compared to what is desired by the body because they tend to be more active in many other things. They might not feel sleepy until well after their bedtime. So the child starts sleeping late and has got difficulty waking up early enough to the school. In the teenage, sleep deprivation leads to mood swings, behavioral problems, and difficulties with concentration and learning. So recently, if you have seen in the states of Telangana as well as in Andhra Pradesh later on, the timing for the schools have been changed. This is because in the year 2014, the American Academy of Pediatrics has recommended that children are not getting enough sleep if the schools are early. That is why in America, they said that the schools should start at 8:30 a.m. The same year, in the year 2014, the High Court of Andhra Pradesh has ordered that the schools should open between 9 a.m. to 4 p.m. and the school duration should not cross 7 hours. Now, coming to another phase in life, pregnancy and sleep. We all know that a pregnant woman needs a good long sleep for her health as well as for the health of her fetus. So, get good sleep during a pregnant woman. She should avoid spicy, fried, or acid foods. Acidic foods, example is tomato, which can contribute to heartburn. Already, the abdomen has got a child, and if you take an acidic food, the regurgitation of food happens. So, you should avoid one should avoid a spicy, fried food. So, if you got lot of heartburn, you need to put some blocks beneath your head so that your head is elevated. You should prevent nausea by eating frequent snacks during the day. If you feel drowsy, take a midday nap. You should exercise regularly to reduce cramps as well as improve sleep. One should cut down on the fluids before bedtime to reduce the nighttime trip to the bathroom. And one should use pillows or special pregnancy cushions to support your abdomen. Later age, that is beyond the age of 60 years, how sleep is, because at that age, as we have noticed, they are unable to get adequate sleep, and that is usually supplemented by a mid-time nap. At any age, a person requires between 7.5 to 8 hours of sleep to function at their best. If you are not able to squeeze that much amount of sleep during the night, you can have a midday nap to compensate for that lack of night sleep. What happens if a person is gets sleep deprived? We all know a sleep deprived person can be more prone to depression and anxiety, is can easily catch cold. Lack of sleep increase the blood pressure, and once a person's blood pressure is increased, they tend to develop heart attack. And a person who is not sleeping well tends to have more and more fat in the abdomen, and that can increase the chances of developing diabetes. So, sleep deprivation has got many side effects on various organ systems. So, how do you define sleep deprivation? Sleep deprivation is of two types. The first type is the complete sleep deprivation. That is what we commonly express as the night out. That means they do not sleep at all at night. So, that is complete sleep deprivation. Partial sleep deprivation is, for example, if a person requires about 7.5 to 8 hours of sleep, he sleeps only 6 hours every day for about 2 weeks. Not for 1 day, 2 days, for about 2 weeks. If the person is not getting adequate amount of sleep, that is what we call as the partial sleep deprivation. Both complete as well as partial sleep deprivation have similar physical and mental effects. So the sleep has to be continuous for a longer time and without any interruption. So that is what is the lesson. So sleep deprivation can happen under two different circumstances. For example, a person is awake for at least for continuously for about 16 to 17 hours. The person becomes sleep deprived and simple tasks also become difficult. That is the reason why drivers and the rest of the people they should be allowed to sleep for a significant amount of duration, without which the simple tasks will become difficult. Continuously, if a person is sleep deprived, that leads to difficulty on working on high concentration items, as well as can lead to mood swings, depression, and increased feelings of tension. Partial sleep deprivation occurs when you get some sleep, but it is not 100% of what you need. Experts refer to this is as building up of sleep debt. So this happens normally for many people. If they do not sleep 2 3 hours minus for about 2 3 days, then they have some sleep debt. That is when they start developing headaches, stomach problems, sore joints, memory relapses, and sluggish reaction time. In addition, people face a far higher risk of falling asleep on the job or while driving. So it can be dangerous if you are a driver. So if you are awake for long, you should always get 7 to 8 hours of sleep, without which you risk falling asleep while you are working. There are two types of disturbances which can have whenever the person is sleep deprived. The first is the micro sleep, the second is the automatic behavior. Micro sleeps, all of us must have experienced at some point of our life, are brief episodes of sleep that occur on during ongoing activity. For example, if I have a lot of emergency cases for a couple of days, then while uh, examining my patients, or sometimes for about 10 seconds or 15 seconds, suddenly you fall asleep. During this falling asleep, you do not close your eyes. You are open in your eyes, but you are unaware of what is happening outside. So that means your brain becomes inactive, or brain becomes this one. So this is really very brief, lasting for about 10 15 seconds, and this is responsible for accidents in many cases. Automatic behavior is the second effect of sleep deprivation or sleep debt, where you tend to do certain activity without knowing or aware of what you are doing. For example, if you are driving on the road, you tend to not to take a left or a right turn or tend to miss the exit. And that is what is an automatic behavior. Unknowingly, you keep driving the car and you miss the exit and you overshoot your destination. So, this is an example of automatic behavior. So, what does sleep deprivation lead to? Sleep deprivation leads to a lot of diseases, commonly diabetes, hypertension, depression, heart attack, obesity, and easily these people can catch viral infections. So, these are the various consequences of sleep deprivation. Now, we come to another topic. The penultimate section is how to get good sleep. Practical tips for a better sleep. Sleep is not a luxury but a basic component of healthy lifestyle. Getting adequate sleep requires time and discipline. Avoid building up a sleep debt and take steps to set up an ideal sleep environment. So, we will understand what is a sleep sanctuary or an ideal sleep environment. We should have a silent room or the noise should be controlled. This can be done by using heavy curtains and rugs which can absorb sounds. Nowadays, you have these PVC windows also, or using double paned windows. So that also will reduce the noise. If the noise is too much, one can use earplugs. Or there are certain simple, inexpensive remedies like use of a fan or a sleep machine which provides a white noise, small dull sound, that's what we call as the white noise, or recording of a soothing sound such as rainfall or a croaking frog or chirping crickets. Silent noise, if it is there in your bedroom, it will control the noise which is coming from outside and a person can fall asleep. You should always make your bedroom a peaceful place that encourages rest, limit noise and light, and keep the room at a comfortable temperature. So, these are the ideal characteristics of a sleep sanctuary. This is what we should have. An ideal sleep sanctuary should have only dim, the light, bright light should be dimmed, and you should avoid watching the television or using a computer after 9 p.m. Don't read from a backlit electronic device such as an iPad at night. You should replace the bright lights with lower wattage bulbs or install dimmer switches that allow you to keep the lights low at night. The other things which will keep you comfortable at sleep are you should sleep in best in a slightly cooler room. You should replace the worn mattresses if they are there on worn pillows. Some people tend to be comfortable with a memory foam mattress. You should avoid pains and get treated. So, musculoskeletal pains should be treated early. One should create a sleep sanctuary by following certain relaxation rituals. Relaxation rituals, when anytime when you go back home, you carry a lot of worries. So, before sleep, those thoughts will keep reeling in your mind. To control them, you should use a worry journal by noting down all the points which are there which are troubling you in a paper, in a book, and that will relieve your stress to a large extent. Listen to soft, calming music, take a warm bath, do some easy stretches, read a book or magazine by soft light, and try mindful meditation. Mindful meditation, there are a lot of exercises in mindful meditation which you can get if you google it, and those steps if you follow you get a nice sleep because you are much more relaxed. Stick to a sleep schedule. Establish a sleep routine. Get up about the same time every day. For example, if you have a habit of waking up at 6 a.m. daily, make a habit of waking up at 6 a.m. You do not wake up at 5 a.m. on one day, 6 a.m. at one day, 7 a.m. on one day. This will disturb your sleep schedule. So you should wake up at the same time every day, even if you had a late night party or a fitful sleep. So that is the reason why you should always put an alarm to wake up at the same time. The other thing is, if you do not fall asleep within 20 minutes, or if you wake up and you still cannot fall back sleep within the same amount of time, you should get out of the bed and do something relaxing until you feel sleepy again. That means you read a magazine or do some small mindful relaxation. So all these things will make you fall asleep again. So you should stick to a sleep schedule, which is very important for you to get a good peaceful sleep. What about napping? Sometimes people say that afternoon napping is not good. Some people say it is good. So, what is the controversy about it? If you want a good night's sleep, then midday nap is a bad idea. If you want to have a peaceful sleep of about 7.5, 8 hours at night only, then you should not have a sleep in the afternoon. You keep the daily sleep dose constant. If you want to remain alert all through the day, then midday nap is recommended. If you want to have a long day, then have a midday nap. If you have to have a good long night, then you avoid a midday nap. An ideal nap duration, midday nap, should no longer be than 1 hour. And even a 15 to 20-minute nap has got significant alertness benefit. So about 30 minutes to 60 minutes is a good time for you to nap. Anything more than that is going to make your brain groggy. Keep a sleep diary for about 2 weeks to about a month, when you went to sleep and when you woke up. Include the entries for the medication you have taken, any coffee or alcohol which you have taken, or any exercise what you have done, or any stresses encountered. So this sleep diary will make you understand what made you fall asleep and what made you remain awake. So this will analyze you to avoid certain things which will making you difficult to fall asleep. Here I have tried to give you certain drinks which have got lot of content of caffeine. Person's individual response to caffeine varies from person to person. Certain people tend to have react very abnormally even with a small dose of caffeine, whereas persons who have got a tolerance to caffeine, they can take a lot of amount of coffee and still fall asleep. So what you need to understand is you should take less of caffeine to sleep well, especially for at least 4 hours before sleeping. You should avoid caffeinated drinks. Now what about alcohol? It is a common misbelief that alcohol makes you fall asleep. No, it is not right. Alcohol depresses the nervous system and may cause sleep, but the sleep induced by alcohol is not good quality sleep. Alcohol disturbs the REM sleep, that is the dream sleep. Alcohol disturbs the dream sleep and makes you awake after a few hours. During the dream sleep, the brain is active and suddenly the person awakes up if he takes alcohol and tries to fall asleep. And alcohol causes frightening dreams and frequent awakenings. And it will surprising. People think that alcohol causes sleep, but no. 10% of chronic insomnia, that means people who suffer from sleep inability to sleep, it is due to alcohol. So don't think that alcohol gives you a good sleep. In fact, it is the other way around. Nicotine and sleep. Nicotine is a potent stimulant that speeds up your heart rate, increases your blood pressure, and stimulates fast brain activity. So people who stop smoking tend to fall asleep more quickly, wake less more often during night, and in fact their quality of the sleep is much better. Usually within about 2 weeks after stopping smoking, they tend to have good quality of sleep and they sleep easily. What about exercise? We should energize with exercise to fall asleep better. People who exercise fall asleep faster. And exercise is the only way known for healthy adults to boost the amount of deep sleep they get. What are the best forms of exercise? The best forms of exercise are walking, jogging, and swimming. So, the aerobic exercises are the exercises which will make you fall in deep sleep and awaken less often during the night. Then, what are the food items you should eat to get good sleep? If a person is hungry when he is about to sleep, that is the time when you feel in difficulty in sleeping. So to overcome that, eat healthy. If you are If you are if you are facing difficulty to fall asleep because you are hungry, take an apple. That will make you feel fall asleep. You take a healthy small food that will make you fall asleep. But instead, if you take coffee, chocolate, alcohol, peppermint, fatty food, that will make you obese. So you should eat less, and if you are hungry and not able to sleep well, then eat a healthy food, a healthy small snack, and drink good quantity of water. It will make you fall asleep. Insomnia. Insomnia can be classified into three groups: transient if it lasts for few days, short term if it lasts for few weeks, and chronic if it is persistent. There are a lot of conditions under which the person can have sleep deprivation or insomnia. It is short term or a transient thing in the face of their death in the family or a separation of a loved one or a nervousness about an upcoming event like an examination, wedding, public speaking. A transient sleep deprivation can happen during jet lag time or whenever there is a discomfort from an illness or an injury. Certain chronic sleep deprivation can happen under medical conditions like diabetes, heart disease, musculoskeletal pain, thyroid disorder, kidney diseases, mental illness. All these things can cause chronic mental deprivation. In addition, certain drugs like beta blockers, diuretics, steroids, sedating antihistaminics, all of them can cause a chronic sleep deprivation. So, how do you tackle insomnia or sleep deprivation? These are the tips how to sleep well. The first tip is behavioral therapy. You should understand that sleep is important, but you should not be fixated by sleep. So, it will happen gradually. So, that is what you should understand. Sleep deprivation is a very important technique to get fall asleep easily. If you are insomniac, try to sleep instead of 8 hours, sleep only for 6 hours, sleep only for 5 hours. For example, you find it difficulty to sleep on one day, you are awake till 12 o'clock. Don't sleep till 8 o'clock or 9 a.m. You wake up at 6 o'clock or you wake up at 5:30 a.m. So what happens? You have got a sleep debt. That sleep debt or the lack of sleep for a couple of hours will be compensated the next day. So you'll be able to sleep by about 9 p.m. or 10 p.m. So creating a sleep debt or a sleep deprivation is the first line of therapy for insomnia. So the important thing is if a person is insomniac, you have to suggest him to sleep less. So this is contrary to what we believe. Stimulus control. For example, if you lie down on the bed for no purpose, so that is stimulus control. You use the bed only for sleep or sex, but don't idle in the bed. Just lying on the bed without doing anything is not a good way. Wake up at a stipulated time daily, as I have already mentioned. Use certain relaxation techniques like meditation, breathing exercises, progressive muscle relaxation, and biofeedback. These can be learned easily on the internet from various books. Then cognitive behavioral therapy is one of the important lines of therapy for insomnia. Cognitive behavioral therapy means misattribution. That means if you don't sleep, you will feel that something is going to happen to you. Hopelessness. You feel miserable because you are unable to sleep. Unrealistic expectations. You think that when you lie down on the bed within the next couple of minutes you should fall asleep. No, you take at least 20 minutes to fall asleep. So you should not have unrealistic expectation. Exaggerating consequences. You say that, oh, yesterday I did not sleep well. That is the reason why today I am unhappy. So such sort of exaggerating the consequence should not be there. Performance anxiety. Oh, today I am unable to sleep now. Tomorrow I will be write the examination. So such sort of cognitive behavioral therapy is directed towards this to remove these misconceptions in the mind is one of the ways or the first line of therapy for insomnia. As doctors, we tend to give so many medicines for an insomniac patient to fall asleep. But you should understand these therapies should only be limited for short term. There are a lot of drugs which I have enlisted here. Out of them, benzodiazepines, that is alprazolam, Alprax, or Restil, diazepam, Valium, or Compos are the commonly used ones. Non-benzodiazepine drugs like Zolpidem, which are commonly available used nowadays. Apart from tablet, nowadays you get the Zolpidem spray. That means when you apply the sublingual spray, immediately you can fall asleep. So there are a lot of newer advances which are coming. in the market and the pharmaceutical front. Of the antidepressants, only doxepin is approved for promoting sleep. There are certain melatonin receptor agonists like meltion and orexin receptor antagonists, that is suvorexant. This the last is the latest drug to promote sleep, which is not yet still available in the Indian market. Now I will address two common issues which can happen to people while falling asleep. One is excessive urination at night. The most common causes of excessive urination at night are diabetes, heart failure, urinary infection, enlarged prostate, liver failure, sleep apnea, and if a person takes increased urination causing drugs at night or alcohol or caffeine. The best therapies are you identify the cause, if any of them are there, treat them. Cognitive behavioral therapy, that is, you ask them to drink less water, no caffeine at night, and if they don't get benefited, there are a lot of drugs which can address an overactive bladder or due to prostatism or urinary infection. So, all these things can be corrected by drugs nowadays very effectively. So, I would like to conclude by saying that during the last 40 minutes, we tried to discuss the various reasons why a person should fall insomniac, how to overcome these insomniac conditions, what are the non medical ways to promote better sleep, what are the medical ways to better sleep. But a fundamental understanding of the types of sleep, what is the function of sleep, what is REM sleep versus non REM sleep, what are the functionalities of the different phases of sleep. All these things are of integral importance for us to understand why dreams can happen, why people get awakened at night with a bad dream, why persons pass urine more at night, or why persons should how a person got good sleep during pregnancy. So some lot of multiple scenarios I tried to analyze and try to give you a good overview of sleep, its disturbances, and how to overcome these things. You are always welcome to pose a question on Raghu at drraghu.com. That is RAGHU at the rate of drraghu.com. Or you can meet me, WhatsApp me on 98481 55650. I repeat, 98481 55650. You can WhatsApp me or send a text message for your queries. In addition, you can find me on my Facebook, Dr. Raghu Cardiologist, to ask any of your queries on how to sleep well. There might be certain other circumstances which you might be experiencing. I am more than happy to solve your questions. Finally, coming to the upcoming webinar for the next month, this time we do it on a Sunday, the March 6th. I am going for a personal training program on the March 5th. On the March 6th, we are going to discuss another important topic, aging successfully. This is will be also again for about a 1 hour period. I do request you all to please attend this program and get benefited from this, which usually you need to pay a lot of money to understand what is happening. I am sure I try to provide a lot of tips and tricks. If there are certain questions, you please you can pose us these questions and we'll be happy to answer them. You can mail us and we'll be more than happy to answer you. And I'm sure this weekend you know how to sleep well. Finally, before I close this, I would like to share with you another small tip is, for example, on a Sunday night, we might feel difficulty to fall asleep. What you need to understand is if you are partying the previous night, that is on a Friday night, if you are partying or Friday night you went for a second show movie and you're awake for a long time, what you need to understand is you should always wake up at the same time. That means you always create a sleep debt. Norm the mistake what we do is on a Saturday morning and a Sunday morning, you sleep till about 9 o'clock, 10 a.m. Then you find it difficult to sleep on a Sunday night. So what you need to do is you should create a sleep debt. If you're partying till late night, wake up at around 6 a.m. on a Saturday morning, and you wake up at the same time on a Sunday morning also. So contrary to the belief that you should sleep longer on the weekend, you should wake up at the same time, and if required you have got certain sleep debt, you can overcome the sleep debt in the afternoon on a Sunday and tend to sleep at the same time, so that you awake much more relaxed and peaceful on a Monday morning back to work. So, a sleep tip for a weekend. I wish you all for a happy weekend. I'm sure the tips should have helped you to restructure your sleep cycle. Thank you all. Thanks for attending this webinar.